uterus today. So this is the pelvic cavity what we are seeing here. So to talk about uterus, it is just a muscular organ. So it is a muscular organ with a shape of pear shaped. You know, we have got a pear shaped like pear shape, you know, right? So in that pear shape, if it is inverted, then we will get a shape of uterus. So uterus, it is an inverted pear shaped organ. And if you want to isolate this, we can isolate that and see. So this is the uterus part, and this is the pear shaped uterus. So this is the shape of the uterus in actual position, and this uterus will be having three parts, such as the upper part. Can you make out the lateral angle over here? So this is the lateral angle where we have got uterine tubes attached. So this is the part where we have uterine tubes, and we will call this part as lateral angle of uterus, or else we will call that as cornua of uterus. And above this lateral angle, that is, we are drawing an imaginary line joining these two lateral angles. So if we draw a line above that, you will make out a dilated part over here. So this dilated part is called as fundus of uterus, and the below the imaginary line till this part, one constricted part you can make out here. So this constricted part is called as cervical region. So between the cervical region and the imaginary line drawn between two lateral angles, we will get a body of uterus. And this part, as we already discussed, this is called as cervix of uterus. So these are the major three parts of uterus, such as fundus, body and cervix. So now we are going to see the shape. If you are seeing shape, no, anteriorly it is rounded. So anteriorly it will have more convexity. If you take the posterior aspect, so if you are seeing the posterior aspect here, it is more flattened. So the posterior aspect of uterus will be flattened, anterior aspect will be convex. So we are going to see the actual position of uterus over here. Position of uterus, if you make out the relation, anteriorly it is related to urinary bladder and posteriorly it is related to rectum. So this is the sigmoid colon part, which is related to the upper part of uterus. Then after it is going to continue as rectum part. So posteriorly we have got relation of rectum, anteriorly we have got relation of urinary bladder. So this is urinary bladder and this part is called as rectum. So between the rectum and the urinary bladder, we have got this uterus position, and it is placed in the lesser pelvis. So now we are going to see about the anatomical parts and their significance.
So in today's video, we are going to deal about another important organ seen in pelvic region of our body. So in abdomen and pelvis, we have got a diaphragm there, which is called as pelvic diaphragm. And just above the pelvic diaphragm, we have got an organ called uterus. So this is a pelvic organ, and here, so we are going to deal about female reproductive organ, that is uterus. So this is uterus we are going to deal. So about the anatomical features we are going to deal. Before going to the detail, first we will understand what are the basic features of uterus. So uterus, if you are seeing, it will be somewhat inverted pear shape. So inverted pear shaped organ is uterus, and it is a thick walled. It is a thick walled, hollow, that is, it is having a cavity inside it. That's why it is having a hollow nature, hollow muscular organ. So it is surrounded by muscle. We are calling that as hollow muscular organ. So uterus, it is an inverted pear shaped organ with thick walled hollow muscular part. And now we have got to see about the situation of this uterus. So to talk about the situation, we are going to see. To talk about the situation of the uterus, it is seen in, as I said before, in the lesser pelvis. We have got true pelvis and false pelvis, otherwise we will call that as greater and lesser pelvis. So in the lesser pelvis, we have got this placement of uterus, and then it is present between two organs, that is between the urinary bladder and rectum Behind we have got rectum and sigmoid colon. That is, in the pelvic region we have got anteriorly urinary bladder, posteriorly we have got rectum and sigmoid colon. So I will show you a cross section, that is sagittal section. If you are seeing sagittal section, we have got anteriorly urinary bladder, half part you are seeing, and then we have got our uterus placed. So we have got our uterus. So this is the uterus which is antewater, and then we have got our rectum and anal canal, rectum and sigmoid colon. So sigmoid colon which is going to continue as rectum. Rectum, this is sigmoid colon, and this is the uterus part which we are going to deal now, and this is the urinary bladder. So this is how the arrangement of or situation of uterus will be seen. This is in the sagittal section. So this is the anterior part and this is the posterior part. Now we are going to see some function, that is the function of this uterus is mainly for embedding of the fertilized ovum, and after embedding the fertilized ovum it is going to retain the products of conception until the fetus undergoes sufficient maturity. It will be stayed in this uterus cavity. So that's why uterus is considered as female reproductive organ which is going to sustain the activity of growth of the fetus. Now we will move on to the other anatomical features, such as we have got some subdivisions for this uterus. So subdivisions we are having. So before going to the details of subdivisions, I will just show you a diagrammatic representation of uterus, how it will be placed. So it is inverted pear shaped, as already said, it will be inverted pear shaped. So we have got, this is uterus, and in this uterus we have got a constricted part at this point, and that constricted part is called as isthmus. So this part is called as isthmus, and here you can see we have got some opening present in the lateral angle of the uterus in the upper part. So this is how it will be seen. So this is the whole structure of uterus. In the lateral part we will be having an opening which is going to give uterine tube. So we have got uterine tube carried the ovary at last. So here we have got our ovary. So same way on either side we will be having uterine tube. Along with uterine tube we will be having two more ligaments present, and those ligaments I will tell you later. First, just for uterus we will know this is the position, lateral angle, we have got uterine tube arising. So this point is known as cornu or lateral angle, where uterine tube is placed. So this is uterine tube. Now we are going to divide this whole uterus part into three parts, such as on either side, as I said, we have got this lateral angle or cornu placed. So from here we have got an imaginary line drawn. So just drawing an imaginary line, above that we have got a dilated part, and this part is called as fundus of uterus. And we have got isthmus here between the imaginary line connecting the two uterine tubes and the isthmus. We have got our body of uterus, and just below that we have got cervix region, and below the uterus we have got another organ that we have got vaginal part. So this cervix will be again divided into two parts, such as, so above the vagina we have got a part of cervix placed, so that is called as supravaginal part. Supravaginal part, and below that where vagina is covering we will call that part of cervix as vaginal part. So this is how we are dividing the uterus into three subdivisions: fundus, body and cervix. Cervix again divided into two parts, such as supravaginal and vaginal part. Now we will move on to axis of this uterus. So talking about the axis of uterus, we have got two types of axis placed, that is anteversion and anteflexion. So talking about the axis of uterus, so we are going to deal about axis. So axis of uterus we are going to deal now. So normal uterus, it is having two types of axis. One is anteversion and another one is anteflexion. So anteversion and anteflexion will be seen. So now we have got sagittal section uterus. If you are seeing, it will be placed in such a way, like this it will be placed. So this is how the uterus will be placed. So this is the anterior aspect, as I already said. In sagittal section, this is posterior aspect, and we know this is fundus, and here we have got body, and this is cervical, which is again divided into supravaginal and vaginal part. Now we will get an angle between the cervix and the vaginal part. So between the cervix and vaginal part, so this is cervix region, and this is body, and this is fundus. Now we are getting an angle between the cervix and vagina, that is this area. Between the cervix and vagina we are getting an angle, and another angle we are getting near to the body and cervix. So junction between body and cervix we are getting another angle. So these are the two angles we have got. The angle between cervix and vagina, it is about 90 degree, and the angle between body and cervix, which will be around 125 degree. And this 90 degree between the cervix and vagina, we are calling that part or that angle as anteverted. So anteversion angle is between the cervix and vagina, and anteflexion, that is forward, and that is between the body of uterus and the cervix itself. So this is how the angle of uterus or axis of the uterus is C. Now this weight of the uterus, if you are seeing, we have got weight of uterus, it is ranging from 30 to 40 grams in weight. Now we will move on to each part separately. So we have got parts such as fundus, body, cervix region. Now about each part we are going to deal in detailed account. Talking about fundus of uterus. So fundus of uterus, if you are seeing, nothing much. We have to know it is a dilated part or expanded part of the uterus. So we have got our uterus, and in uterus the dilated part is called as, so this is the dilated part where we will be having an imaginary line below drawn from the uterine tube. So this is the imaginary line. Just above the imaginary line, this expanded part is called as fundus of uterus. It is situated above the imaginary line joining the lateral angle or cornua, and it is directed forwards. So it is directed forwards, you can make out here, and it is convex on all sides. If you are taking fundus, it will be seen convex on all sides and will not be having any uterine cavity present inside it. So in uterus as such, we have got our uterine cavity, but not in the fundus region. Except fundus region, we have got a hollow area that is called as uterine cavity and cervical canal, which is not seen in the fundus region. So we will move on to the body part of uterus now. So we are going to see body of uterus. So for dealing the body of uterus, we are having the extent of body of uterus. It is from fundus to isthmus. As you know, we have dealt the shape, pear shape. So this constricted area is called isthmus, and here we have got imaginary line, fundus, and this is body, and this is isthmus. So location, if you are seeing, it is from the imaginary line drawn between the lateral angle to the isthmus part of uterus. So this is the extent of body of the uterus we have got, and here we have got a hollow cavity, and that cavity is known as uterine cavity. We will be having a space inside it near to the body or inside the body, and that is known as uterine cavity. So this is the uterine cavity we have got. Now we are going to deal about this body of uterus under some parts, such as we have got two surfaces, two borders, and one cavity, that is uterine cavity. So this is how we are going to deal the body of uterus. So now we will see the anterior and posterior surface first. So to talk about anterior and posterior surface, we are going to show a image having sagittal section. So we are having urinary bladder, and we have got our uterus. This is our uterus, and here we have got our rectum and anal canal. Sorry, sigmoid colon with rectum. So sigmoid colon with rectum we have got. This is uterus and this is urinary bladder. Now we are going to deal about surfaces. So this is the anterior aspect. So anterior surface of the uterus will be here, and this is the posterior surface, posterior aspect. So this is the posterior surface of uterus. So only the uterus we are going to concentrate now. So in the anterior surface we have got a pouch coming from the peritoneal fold coming from the abdomen is going to cover the urinary bladder above, and then it is going to cover the uterus anterior aspect of the body. So in the anterior aspect of the body it is going to cover, and then it is going to form a pouch above. So this is the pouch we have got between the anterior surface of uterus and the urinary bladder. Same way the pouch will extend behind, and it is going to extend till the rectum. So it is going to extend till the rectum, and it is going to form a pouch again. So we have got a pouch in the anterior aspect and posterior aspect. The anterior aspect pouch between the uterus and urinary bladder, we are calling that as utrovesical pouch. So we are getting a anterior surface relation, that is utrovesical pouch. So vesicle in the sense it is terming the urinary bladder. Utrovesical pouch will be here. So that is this. And then we have got posteriorly again another pouch present, and that pouch between the rectum and uterus. So we are calling that as recto utrine pouch. It is have got another name, and that is called as pouch of Douglas. Pouch of Douglas. It is the another name for this recto-uterine pouch which is seen here. So this is the recto-uterine pouch we have got. So this is how it is related. Along with this, in this pouch we will be having some contents of small intestine also placed over here. So that relation also we can mention, that is coils of small intestine. Along with the part of sigmoid colon also will be related. So this all about the relation of anterior and posterior surface of uterus we have got. So about the uterus we are dealing now. In that we are dealing about body. In body two surfaces we have seen now. Now we are going to see lateral border. Talking about the lateral border, we have got again our uterus. So this is anterior and this is posterior surface. Lateral border. Talking about lateral border, again we have got our uterus. Here uterine tube will be seen. So in the lateral border we have got a ligament extending, and that ligament is known as broad ligament. So which is a important ligament or false ligament. It is extension of peritoneal fold. So we are calling that as a false ligament, and that ligament getting attached all over the lateral border of body. So that ligament is called as broad ligament. So in the lateral border of the body we have got broad ligament. Along with the broad ligament we have got an artery passing over the broad ligament. Along the lateral border of body of uterus we have got an artery passing, and that artery is nothing but uterine artery. So another relation in the lateral border is uterine artery. So these are the structures seen in the lateral border of uterus, body of uterus. So we are dealing about body of uterus here. Body of uterus, two surfaces we have seen, anterior and posterior surface. And about borders we have got two lateral borders on either side, which is giving attachment to broad ligament first and uterine artery too. So then we will be having uterine cavity to talk about. So we have got a cavity, and that cavity is called as uterine cavity. And talking about this uterine cavity, if you are seeing that then as a whole thing, it will be somewhat triangular in shape. And in sagittal section if you are seeing, it will be a vertical slit. It will be seen as a vertical slit. So it will be seen as a vertical slit, and if you are taking a transverse section, it will be seen as a transverse slit. So that is the difference of uterine cavity, how it is placed. Now we will move on to the lateral angle between the fundus and body. So we have got our lateral angle of uterus placed. So about that we are going to deal now. Lateral angle of uterus. So talking about the lateral angle of uterus, it is seen between the junction of fundus and body. So between the junction of fundus and body, we have got this lateral angle placed, and this lateral angle is very important question which is commonly asked. We have got our uterine cavity over here, and now we have got this lateral angle which is carrying three important structures. One structure we have already dealt, and that is nothing but we have got our uterine tube placed, which is going to get attached with ovary. So on either side we have got our uterine tube coming out. So we have got our uterine tube here, which is going to carry the ovary. So we will be having ovary over here. And now we have got along with that two important ligaments attached. One is round ligament of uterus. So it is a true ligament of uterus. We have got round ligament of uterus attached. Just below the round ligament we have got another ligament, and that is for the ovary. So we have got one more ligament which is going to get attached with the ovary, and that is ligament of ovary. So we have got three important structures. One is uterine tube, emergence of uterine tube. So we are talking about the lateral angle, that is this point which is called as cornu. And here we have got three structures. One is uterine tube, another one is round ligament of uterus, and the next one is ligament to ovary. So ligament of ovary. So these are the three important structures we have got in the lateral angle, which is very important thing. And in uterus, this lateral angle is the point where the junction of body and fundus of uterus will be seen. So now we are moving on to the next part. So we have dealt about fundus and body of uterus. Now we are going to see details of cervix of uterus. So we are going to deal with cervix of uterus. Talking about cervix, as I already said, it is extending from internal os to the vagina, to inside vagina, that is external os. So we are having uterus again. So we'll be having, so this point, the isthmus point, is nothing but we have got internal os present over here. So opening, and another opening is present in the external os at the end of the uterus. We will call that as external os. So just below the internal os, this whole cylindrical region is called as cervix region. So this cervix region again will be divided into two parts. That is, we will be having vagina over here. So vagina is starting from here. Just above the vagina, this whole part is called as supravaginal part. And the part which is dipped into vagina, we will call this part. So till here, this area is called as supravaginal, and the part which is dipped into vagina, we will call that as vaginal part. So this is the two parts of cervix we have got. And about the course, if you are seeing, it is going to protrude downwards, backwards from the isthmus through the anterior wall of vagina, and it is going to have a canal inside, and that canal is called as cervical canal. Now we are going to deal about the relation of this whole part, this cylindrical part of uterus, cervix. So we are going to deal with relation of cervix, relations of cervix. So talking about relation of cervix, so in this we are going to see parts relation separately. So first we are going to deal about supravaginal part. So we are going to see about only the supravaginal part of cervix. So supravaginal part we are going to deal. So to talk about supravaginal part, again we have got anterior surface and posterior surface. So here we have got our again sagittal section we are taking with urinary bladder, and then we have got our uterus, and then we will be having our rectum. So we will be having structures like this. In this we have already dealt, we have got some pouches extending from urinary bladder, that is we have got rectovesical pouch. Same way behind the uterus, between the rectum and here we have got another pouch extending till the rectum. So we have got like this. This is urinary bladder, uterus and sigmoid colon with rectum here, and this pouch will be deeper. This is above. So now we are going to deal about supravaginal part. It will be somewhere here. So about this part we are going to deal. So talking about this supravaginal part, we are having again anterior surface and posterior surface. So in the anterior surface, you can see only the base of urinary bladder will be seen, not the pouch extending. So the pouch is extending till the body of uterus. In the supravaginal part, anterior surface, we are having only the base of urinary bladder. So base of urinary bladder will be seen. And here, along with this, here some tissue things will be seen. So those tissues, a tissue will be seen between the urinary bladder and the supravaginal part, and that tissue is called as parametric separated. This is separated, urinary bladder is separated from the supravaginal part by parametric tissue. Parametric tissues. So parametric tissue will be seen between this. So this is the anterior surface relation of supravaginal part. So talking about posterior surface, here you can make out this pouch is dipping till the supravaginal part. So first relation is we have got recto utrine pouch, that is pouch of Douglas. And then we have got here inside this we will be having some coils of small intestine as it is extending, same like body. Posterior surface is similar for this also. So coils of small intestine will be seen. So these are the relation we have got for anterior and posterior surface of supravaginal part. So anterior and posterior surface we have dealt. Now we will move on to sides. On sides, so we are taking our vaginal part, so only this part. On the sides of the supravaginal part, on the sides of supravaginal part, we have got again the extension of ligament. We already dealt, we have got broad ligament all over the sides of the uterus. So this broad ligament is extending here also. So lateral border is related to broad ligament and also to artery, as seen there. We have got artery passing here, that is uterine artery. And then we have got one more structure which is passing to the lateral. So in the lateral aspect of the supravaginal part, we will be having passage of uterus, ureter also will be seen. So we have got ureter also placed. And then we have got some lymph nodes seen on the sides, that is again paracervical lymph nodes. Along with this, we have got, if you are taking a transverse section, this is cervix region. Just near to the cervical region, we have got another band of ligament extending. So we have got another band of ligament extending from the cervical region, and that ligament is known as Meandros ligament. Meandros ligament. So this is again an important feature of the cervix. So about cervix, supravaginal part we are dealing, anterior surface, posterior surface relation, and on side relation we have seen now. Now we will move on to the important aspect, that is we have got some ligaments which is going to support the uterus to stand in proper position. So we have dealt with all the parts and the general feature of uterus. Now we will deal with the ligaments, which are very important structures to keep the uterus in proper position. So we have got lot of ligaments over uterus, such as we are going to deal about ligaments of uterus. So about ligament of uterus we are dealing now. So talking about ligament of uterus, we have got two types, such as true ligaments and false ligaments. So talking about true ligament, it is about 8 in number. This is about 6 in number, and these true ligaments are nothing but fibromuscular band. Fibromuscular band. So those things are we are calling as true ligaments. If you are taking false ligaments, those are peritoneal folds. So peritoneal folds are considered as false ligaments. Now true ligaments, I will just name all the true ligaments which we have got 8 in number are actually 4 but are paired, which will be seen on either side. That's why we have got 8 true ligaments. So we have got 4 paired ligaments. And in peritoneal folds, that is false ligament, we have got 2 pair and 2 unpaired. 2 pair which is having 4 and unpaired 2. Total 6 false ligaments we have got. So just I will show you what are the ligaments, name alone, and then we will deal about the details of each ligament separately. Talking about pair ligament, we have got first ligament as round ligament, and then we have got Meandros ligament, and then we have got uterosacral ligament, and then pubocervical ligament. And then talking about the unpaired. So unpaired, if you are taking, we have got again some folds, that is anterior false ligament, posterior false ligament, and we have got broad ligament, and along with this we have got some ligaments which is going to connect uterus. So uterus with the rectum. So that is recto utrine fold. So these two are paired. These two are unpaired. So this is how we have got ligaments of uterus placed. So 4 paired ligaments, and we have got these unpaired ligaments, 2 in number, and 2 paired ligaments in false ligaments. Now we will deal about all these ligaments separately and in a detailed account. First we will move on to round ligament of uterus. Round ligament of uterus. So we are going to see about round ligament of uterus. So this round ligament, if you are seeing, it is a fibrovascular band, as we already know, and it is a remnant of gubernaculum of ovary. We have got developmentally a part in uterus or in your female reproductive system, that is gubernaculum of ovary, which is going to exist as round ligament of uterus at later part. So this round ligament, it is a fibromuscular band. and here it is about 10 to 12 centimeter in length. Now we are going to deal about the course and how it is placed. So for that we have got our uterus, and we have dealt about this round ligament where it will be seen. So we have got our lateral angle of uterus placed. So we have got, this is lateral angle or conva. In conva, as we already know, we have got our uterine tube, and the next structure what we have is this round ligament. So this round ligament, it is taking its origin from the lateral wall or lateral angle of the uterus, and then it is going to pass behind, and that is we will call as forwards and laterally, and it is going to pass through the broad ligament. You know, here in the lateral aspect or lateral border we have got altogether broad ligament placed. So here we have got broad ligament placed. Through the broad ligament it is going to come, and it is going to reach the lateral pelvic wall. So we have got lateral pelvic wall over here. So it is going to reach the lateral pelvic wall and going to cross it. So it is going to cross the lateral pelvic wall. After crossing the lateral pelvic wall, it is going to come medially. So after reaching the medial aspect, it is going to reach a ring called deep inguinal ring. And then deep inguinal ring, it is going to have a channel, and that is inguinal canal. Later it is going to end up in superficial inguinal ring. This is deep inguinal ring, and this is superficial inguinal ring. This is the inguinal canal part. And so this round ligament, after crossing the lateral pelvic wall, reaching the deep inguinal ring, then it is going to pass through the inguinal canal, reaching the superficial inguinal ring. It is coming out and it is getting split into many fibrous bands or threads. So it is going to divide into many fibrous threads, and these fibrous threads are getting attached to subcutaneous tissue. So it is getting attached to labium majus. Labium attached to labium majus. So in labium majus we have got subcutaneous tissue. So subcutaneous tissue of labium majus is giving insertion for this round ligaments fibrous bands. So this round ligament taking its origin from lateral angle, and it is passing through the broad ligament. So here we have got broad ligament. Through the broad ligament it is passing, going laterally and reaching the lateral pelvic wall. So after reaching the lateral pelvic wall, it is crossing, and then it is reaching the medial aspect, reaching deep inguinal ring, passing through inguinal canal, and then reaching the superficial inguinal ring, splitting into fibrous bands or fibrous threads. At last it is getting attached to subcutaneous tissue of labium majus. So in the subcutaneous tissue of labium majus, at last it is going to end up. So this is the course of round ligament of uterus we have got, which is also holding the uterus in proper position. Now we will move on to Meandros ligament. So next ligament what we are going to see is Meandros ligament. So about Meandros ligament we are going to deal now. So talking about Meandros ligament, this ligament is otherwise known as cardinal ligament. Cardinal ligament, or else it is otherwise called as transverse cervical ligament. Cardinal ligament or transverse cervical ligament is the other name, and this Meandros ligament is also a condensation of parametric tissue. So around the cervix we have got some condensation of parametric tissue. It is going to form this Meandros ligament. So talking about Meandros ligament now, it is mainly attached to cervix region. So this Meandros ligament we are going to deal in the cross section. If we are dealing, we will be having like, so if you are seeing as such, we have got our uterus and cervical region. And in the cervical region, surrounding the cervical region, we have got this ligament extending. So it is going to extend like this Meandros ligament. So after extending from the cervix, it is going to attach with the lateral pelvic wall muscles. So we have got lateral pelvic wall muscles such as levator ani. Till there it is going to extend. So from cervix to the lateral pelvic wall muscle, it is going to extend, that is Meandros ligament. So it is going to extend. While it is getting, it is also going to transmit, or it is going to relate with some important structure, such as we have got ureter related to it, and then along with this we have got our uterine artery also passing near to it. So we have got two structures related to the Meandros ligament, such as ureter and uterine artery. So that's all about Meandros ligament we have to know. It is a main ligament or important ligament which is going to hold the cervix in proper position. So now we will move on to the other two ligaments, that is uterosacral and pubocervical ligament. So here only I will be showing. So first we will deal with uterosacral ligament. Uterosacral ligament and pubocervical ligament. Actually speaking, this is posterior ligament, this is anterior ligament. That is the only difference. I will show you in a picture. We have got our uterus in sagittal section likewise, right? So now behind this we have got our rectum and anal canal. And rectum, sigmoid colon, rectum and anal canal will be seen. Behind that we have got our sacrum placed. So we have got our sacrum placed. So here we have got sacrum with first, second, third, fourth and fifth vertebra, which is fused together as a single vertebra. Now from the cervix region till the third sacral vertebra, from the cervix region of uterus, somewhat here we have got cervix, from cervix region till the third sacral vertebra we have got some ligaments extending. So likewise we have got some ligaments extending from the cervix to the third sacral vertebra. So this ligament is called as uterosacral ligament. So which is going to pull or keep the angle in proper position, that is uterosacral ligament from the uterus cervix region till the third sacral vertebra. This is third sacral vertebra. This is vertebra, so show in black color. So sacral vertebra. Till the third sacral vertebra it is going to extend. Now we will move on to pubocervical ligament. Name itself indicates it is going to join the pubis and the cervical region. So we have got urinary bladder over here. Behind that we have got our uterus. So we have got our uterus. And in front of the urinary bladder we have got a bony part called pubis. So we have got our pubic symphysis. So just lateral to it we have got pubic bones surfaces seen. Inner surface of pubis is going to give attachment for this pubocervical ligament. From the posterior surface of pubis we have got the ligament extending till the cervical region. So it is going to extend till here from either side. So this ligament is known as pubocervical ligament. So this is pubis and this is the uterus, cervix and bladder. So this is how we have got all true ligaments placed. So we have seen the collection of true ligaments: round ligament, Meandros ligament, uterosacral and pubocervical ligament, where all these ligaments are paired ligaments. Now we are going to deal about false ligaments, which are having both paired and unpaired parts. So talking about false ligaments. False ligaments we are going to see. As I said, false ligaments are nothing but peritoneal folds. Only peritoneal folds we are calling that as false ligaments. So first we are going to see anterior false ligament. So first ligament what we are going to see is anterior false ligament or utero-vesical ligament. Same way, second, both are unpaired what we are dealing now. So posterior false ligament or recto uterine fold. So these are the two false ligaments we have got. So about that we are going to deal. So those are nothing but a peritoneal fold collection. So that we are calling as ligaments or folds. So now we will talk about uterovesical ligament or fold. So we have got, I will show you in a single image both the things, such as sorry about this, posterior false ligament recto-vaginal fold. I'm sorry. So second one is recto-vaginal fold. So recto anteriorly to the urinary bladder, so we are calling that as uterovesical. Posteriorly to the vagina, so we are calling that as recto-vaginal fold. So I will show you in a single image. So we have got a bladder and the uterus, and then we have got our rectum. So likewise we have got the three organs in sagittal section: bladder, uterus and rectum. Now between this, we have got some pouches. So we have got a pouch between bladder and uterus. Same way between the uterus and rectum we have got another pouch extending. So here about the uterovesical ligament or uterovesical fold, it is a fold nothing but presence of the pouch. So the pouch is called as the uterovesical pouch is called as uterovesical fold, which is seen related to the anterior surface of uterus. So this is nothing but the fold which is related to the uterus. We are calling this part as uterovesical or anterior false ligament, vesical fold or anterior false ligament. Same way recto-uterine pouch will be seen, which is extending downwards, and the fold which is present over here we are calling that as recto-vaginal fold. So these are the two false ligaments we have got, and these ligaments are nothing but the layer of the pouches which we are having related to anterior and posterior surface of uterus, and both the folds are unpaired. Now we will move on to the paired ligament, that is recto-uterine fold. So we have got another ligament, that is recto-uterine fold. So this recto-uterine fold, it is going to extend from the uterus to the rectum. So from the, we have got a ligamentous string, such as we have got our uterus and then we have got our rectum. So now what will happen is, from the cervical region of uterus, we will be having a fold or a ligamentous extension which is going to cover whole of this, forming a sling-like portion. So forming a sling-like portion, it is going to cover from either side. So from anterior and posterior aspect, we have got a sling which is going to cover both the rectum and uterus cervical region, and this is seen on either side, right and left. So we are calling that as recto-uterine fold, the fold extending from cervix to the rectum. So this is the uterus we have got, and this is the rectum, and this is the cervix region. So this is how we have got relation of all the folds, that is peritoneal folds which are considered as false ligaments are seen over there. And now we are going to deal about broad ligament in a detailed account. So to talk about the broad ligament, we have got, so we will deal in a separate sheet. So we are going to see about broad ligament. in detail. So broad ligament is also a false ligament, which is a peritoneal fold, but it is paired ligament. It is going to have a wide attachment over uterus. So if you are taking uterus, so we have got uterus, lateral angle with uterine tube, and here we have got on either side near to the lateral border, we have got attachment of this broad ligament. So the broad ligament, it is getting attached all over the lateral border of uterus. So we have got our broad ligament attached like this. All over the lateral border we have got attachment of this broad ligament on either side. In the broad ligament on the sides we have got a structure passing, and that structure is nothing but uterine artery. So we have got our uterine artery passing on the broad ligament superior surface. So we have got this broad ligament anterior surface and posterior surface. In the anterior surface we have got this uterine artery placed. We can also divide this broad ligament into 4 parts. So it will be somewhat like this, the shape of the broad ligament. So we have got superior border, inferior border, and medial. We have got medial border, and this is lateral border. So superior border we have got presence of this uterine tube. So in the superior border we have got the medial 3/4 related to the uterine tube. So medial 3/4 is related to uterine tube, and the lateral 1/4, this part is going to form suspensory ligament of ovary. So we have got the broad ligament. So this whole thing is considered as broad ligament. So in broad ligament we are having some borders, medial, lateral, superior and inferior. The superior border is going to carry in the medial 3/4 the uterine tube. In the lateral 1/4 the part remains is going to form thickening towards the ovary, and that is called as suspensory ligament of ovary. And then we have got lower border. This lower border will diverge, and after diverging we have got 2 structures passing through it. One is ureter, another one is uterine artery. So 2 structures are passing through the inferior border. So inferior border or lower border, it is getting diverged to passage or to pass uterine artery with ureter. So these are the 2 structures which are going to pass through the inferior splits. Now we are having medial border. In the medial border we are having our uterine artery passing. So from the inferior border it is emerging upwards towards the medial border of the broad ligament. So medial border is related to the uterine artery. So now we have got lateral wall. Our lateral border, it is getting attached to the lateral pelvic wall. So we have got a muscle for lateral pelvic wall, levator ani, till there it is getting attached. So I will summarize again. Broad ligament, it is a peritoneal fold getting extended in the or attached in the lateral border of the uterus on either side. This broad ligament is going to carry an artery along with it, that is uterine artery. And talking about the broad ligament, we have got some parts such as superior border, inferior, medial and lateral border. Talking about superior border, we have got 2 parts, medial 3/4 and lateral 1/4. Medial 3/4 is going to carry uterine tube. Lateral 1/4 is going to thicken to form the suspensory ligament of ovary. And inferior border, it is going to split. So ligament, inferior border, it is going to split, and it is going to give passage of uterine artery and ureter. Talking about medial border, we have got relation of uterine artery. In the lateral border, it is getting attached to the lateral pelvic wall. So that's all about the details of broad ligament we have got. And we have got many structures related to broad ligament, such as we have got uterine tube. And second structure below the uterine tube, we have got round ligament of uterus and ligament of ovary with ovarian vessels, uterine vessels, and also some tubules of hypophrone, paraophrone, which are seen developmentally in embryology. If you know all these things, it will be easy for you to understand. So tubules and ducts of hypophrone and some tubules of paraophloem will be seen. Some lymphatics and nerves will be scattered over here, and accessory suprarenal tissue may also will be placed over this area. So these are about the details of broad ligament we have got. Now we will move on to some supports which is going to hold the uterus in position. We have got supports such as mainly formed by, we have got supports mainly it is concerned with. So suppose we are going to deal, so broad ligament, I will just tell important supports for keeping the uterus in proper positioning. The supports are muscular, ligamentous, ligament, viscera, and loose packing material, loose packed material. So these are the 4 things it is going to be necessary for supporting the uterus in proper position. The muscle is pelvic diaphragm, and the ligament is Meandros ligament, which is a true ligament and a paired ligament, and along with round ligament of uterus. And then we will be having uterosacral ligament. Especially the true ligaments are necessary for holding the uterus in proper position. And the viscera such as anteriorly the urinary bladder, and posteriorly we have got rectum, which is very necessary for keeping the or maintaining the proper middle position of the uterus. And then we have got the loose packaged material, that is parametric tissues, which are fibroareolar tissues, and those tissues are very important to hold the or important factor for holding the uterus in proper place. So these all about the supports of uterus we have got. All muscles and ligaments, viscera surrounding it are responsible for holding it in proper positioning. Now we will deal with some important features of arterial supply, lymphatic and nerve supply. So talking about the blood supply of uterus, so we have got blood supply. So talking about blood supply, arterial supply is mainly by supply. It is mainly by uterine artery. So uterine artery is going to supply major part of the uterus, and the occasionally or partly the uterus is supplied by. So partly the uterus is supplied by the another artery which is present nearby, that is ovarian artery. So these are the 2 arteries which are responsible for the arterial supply of uterus. And talking about the venous drainage, if we deal about venous drainage, the accompanying veins of these arteries are important for the venous drainage. So that is nothing but uterine and ovarian vein. So uterine vein and ovarian vein, which are going to at last drain into systemic vein. So these are the arterial and venous drainage of uterus we have got. So blood supply of uterus we have dealt. Now talking about the nerve supply. Nerve supply, if you are seeing, we have got, as like other organs, we have got again sympathetic and parasympathetic. Both sympathetic and parasympathetic are mainly by ovarian and uterovaginal plexus. So the plexus near to the ovary and uterus and vagina junction, that we will call as uterovarian plexus and uterovaginal plexus, which are responsible for the function of uterus. About the details we will deal later. Now about the anatomical description of uterus, these are the important things. Just mention the names, that is enough. Now we will move on to the lymphatic drainage, which is also an important topic in uterus. So we will deal that also in little detail account. So talking about the lymphatic drainage. So we are going to see lymphatic drainage of course it is uterus. So talking about lymphatic drainage of uterus, again we have got our uterus, have got our uterus placed, and in the lateral angle we have got uterine artery, all details as you know. And now we have got an artery above, that is we have got our aorta, abdominal aorta, right and left iliac, which is again dividing into external and internal. So it will be dividing like this. Now we have got our aorta over here. So now we have got some lymph nodes present surrounding this artery and the uterus. Those lymph nodes are in front of the aorta. We have got pre-aortic lymph nodes. So we have got pre-aortic lymph nodes, and on sides we have got lateral aortic lymph nodes, and then we have got here somewhere behind the artery we have got sacrum, so that we can show it as sacral lymph nodes, and we have got our iliac. This is internal iliac artery and this is external iliac artery. Here also same, external iliac artery, internal iliac artery. Surrounding this external iliac artery, external iliac lymph nodes, and here we have got internal iliac lymph nodes, external iliac lymph nodes. And then on either side of the cervix region we have got paracervical lymph nodes. So this is how we have got lymph nodes arranged surrounding the uterus. Now for knowing about the drainage of this lymphatics, we are dividing it into some parts, such as we have got our fundus and body together. Fundus, we have got this as fundus, you know, this is fundus, this whole thing is body, and this is cervix, as you know. Now this body again we are going to divide into two, that is upper part and lower part. So now this fundus and body are getting, so this fundus and the upper part of body, fundus and upper part of body, both are getting drained into lateral aortic and pre-aortic lymph nodes. So from here it is passing upwards, here and here, both upper part of body and the fundus. So upper part of the body and the fundus are getting drained into pre-aortic and lateral aortic, pre-aortic and lateral aortic lymph nodes. And then we have got lower part of cervix, lower part of body. So lower part of body, it is getting drained into external iliac lymph nodes. So it is going towards the external iliac lymph nodes, external iliac lymph nodes. Now we are having only the cervix region, that is we have got cervix. Again we are dividing this whole cervix, we are taking both supravaginal and vaginal part, we are taking into lateral drainage, posterolateral drainage and posterior drainage. Lateral drainage, it is to as like that we have got laterally to paracervical lymph nodes. Posterolaterally it is getting drained into internal iliac lymph nodes. So internal iliac lymph nodes, and some posterior most cervix is getting drained into sacral lymph nodes. So I will summarize again. We are talking about cervical region. So about cervix we are having the drainage in three parts. One is lateral, another one is posterolateral, another one is posterior. So lateral one getting drained into paracervical lymph nodes, Posterolateral, it is getting drained into internal iliac lymph nodes. The posterior most, it is going posteriorly. Get an imaginary idea how it is. So posteriorly it is getting drained into sacral lymph nodes. So this is how the whole drainage of uterus is happening. So these are the division we have got: fundus and upper part of body to pre-aortic and lateral aortic, lower part of body to external iliac lymph nodes, and cervix in this three way. And about the anatomical features of uterus on the whole we have finished. About the clinical aspect, if you are taking, we have got a condition called endometriosis, where the endometric tissue of the body or of the uterus, it will get settled outside the uterus. Other than uterus, it will get settled, and those tissues are called as, if it is placed, if it is present in our body, we will call that as endometriosis condition. And we will be having tumor condition called leiomyomas, and we have got our cervical cancer in a common case, and that carcinoma is a very common carcinoma we have got, so we will call that as carcinoma of cervix. So these are the clinical aspect or clinically oriented problems related to the uterus we have got. About the these are the anatomical features such as parts, about the relation and their ligament attachment, those things and all. Along with this, if you know the physiology part and how it is divided histologically, what are the parts we have got, what are the muscle layers we have got, it will be good for you to remember in a further case. Thank you for listening.